Myself, Dr. Cheetna Meena from Pharmacology Department, Savai Mansingh Medical College, Jaipur. Today I have class on newer beta-lactam antimicrobials. So before starting or talking on the newer beta-lactam antimicrobials, I want to revise the classification of beta-lactam antimicrobials. So what are the beta-lactam antimicrobials? These are penicillins, cephalosporins, carbapenems and monobactams. So there are 4 drugs of group which are included in beta-lactam antimicrobials. Out of these 4, last 2, carbapenems and monobactams are included in newer beta-lactam antimicrobials. First I will take carbapenems. So what are the carbapenems, or what are the drugs which are included in carbapenems group? These are imipenem, meropenem, ertapenem, ferropenem and doripenem. Once again we can revise: imipenem, meropenem, ertapenem, ferropenem and doripenem. These are carbapenems. Then take one by one these carbapenems. First I will take imipenem. It is acting against gram-positive cocci, Enterobacteriaceae, Pseudomonas aeruginosa, Listeria and anaerobes like Bacteroid fragilis and Clostridium difficile. Imipenem are not active orally, so they should be given by IV route. An important feature of imipenem out of these all carbapenems are that it is the only drug which is rapidly hydrolyzed by dehydropeptidase enzyme, which is located on the brush border of renal tubular cells. So it is always given with combination of a drug cilastatin, which is inhibitor of dehydrogenase enzyme. Then it is used against hospital acquired infection in hospitalized patient, or it is reserved for the resistant microbial infection. So uses: number 1, it is used for complicated urinary tract infection, lower respiratory tract infection, intra-abdominal infections, gynecological infections, skin and soft tissue infections, bone and joint infections. And it should be combined with aminoglycosides for the treatment of Pseudomonas aeruginosa infection to prevent the development of resistance. Means take caution: whenever it is used for the treatment of pseudomonal infection, then it should be combined with aminoglycosides like gentamicin or other for prevent development of resistance to pseudomonal infection. Then side effect: these are nausea, vomiting and seizure in high doses. These are side effect of imipenems. Then coming on the next drug, meropenem. It is active against both gram-positive and gram-negative bacteria, aerobes and anaerobes, but it is more potent against the Pseudomonas aeruginosa infection. Indication of meropenems are septicemia, febrile neutropenia, intra-abdominal infections, pelvic infections, diabetic foot. Meropenem side effects are nausea, diarrhea and vomiting, hypersensitivity, and it less likely to cause seizure. So this is important. It is less likely to cause seizure. That's why it is preferred over imipenem, and it is for its use we don't need the combination with the cilastatin drug, because it is not hydrolyzed by dehydropeptidase enzyme, and it is given by intramuscular and IV route. So one of the side effects may include the thrombophlebitis of a drug or injection site pain, because given by the injective route. Next drug is doripenem. It is also given by IV route, active against the resistant Pseudomonas. This is an important feature of the doripenem, because it is reserved for the resistant pseudomonal infection indication same as the meropenem, means it is can be used for the respiratory, gynecological and abdominal infections. And side effects are nausea, vomiting, and it is also less likely to cause the seizures. Then ertapenem is the next drug. The peculiarity of this drug or specificity of this drug, it has the long T half among the all of carbapenems. So its long T half allow once daily dose, which is convenient for the patients as well as for the doctors. So the indication, it is used for the resistant skin infection, diabetic foot without osteomyelitis. It is used for the community acquired pneumonia, in short it is called a CAP, and complicated urinary tract infection, abdominal infections, pelvic infections, gynecological infection, and lastly it is used for the colorectal surgery. Side effect of ertapenems are headache, confusion, diarrhea, and the thrombophlebitis of the injected vein. So next drug is foropenem. The special feature of the foropenem, that it is only carbapenem which is available for oral use. It is acting against gram-positive and gram-positive bacteria, highly active against anaerobes. It's indicated in ear, nose and throat infections, respiratory tract infections, genitourinary infections, and adverse effects of foropenems are nausea, diarrhea and abdominal pain. Then the another group, newer group of, or we can say the newer beta-lactam antibiotics is monobactam. It inhibits the gram-negative cocci. It is indicated mainly in hospital-acquired infection, especially to the patient who were allergic or resistant to penicillin and cephalosporin, but it is not given to the ceftazidime in case of the ceftazidime, because ceftazidime has structure similarity to monobactam. So the drug which is included in this group is azithromycin, is only one single drug which is included in monobactam group. Now the questions. Number 1, beta-lactam metabolized by renal dehydropeptidase, or I can say the name beta-lactam antibiotic which is metabolized by renal dehydropeptidase. So you can give answer whether it is ferropenem, meropenem, imipenem or doripenem. As you recognize my lecture, or if you listen carefully, then I told you that answer is C. Only imipenem is hydrolyzed by renal dehydrogenase enzyme. Another next question is orally active carbapenems is which? So that is only the foropenem. This again included in my lecture if you listen carefully. Then carbapenem used for the treatment of resistant pseudomonal infection. Which one? For the resistant pseudomonal infection, this is, you should give the answer yourself, because I will tell in my lecture. Which carbapenem induce seizure? इसका भी आंसर आप अपने आप दे सकते हैं. And all the beta-lactamase inhibitors except, so which one? Clavulanic acid, sulbactam, trazobactam or manobactam. In this, as you know, clavulanic acid, sulbactam and trazobactam are beta-lactamase inhibitor. Only the monobactam is not an penicillinase inhibitor because it is a newer beta-lactam antibiotic. It is not a beta-lactamase inhibitor, but it can be resistant against the beta-lactamase enzyme. So think healthy, eat healthy, read good literature, feel happy. Thanks, best wishes for your future.